the incidence of revitalization of vital teeth associated with pathologies of the jaws following surgical intervention. This is a recently published paper by a Saudi group from King Abdulaziz, Dr. Muhammad Alharbi and his colleagues in 2023. So performing surgeries next to adjacent teeth is challenging as you always run the risk of revitalizing them. Despite the importance of this topic, it is scarcely reported in the literature, and if we examine the evidence that we have, you will find some theoretical explanation for the revitalization. You will also find case reports here and there, and also some reports of animal models that shows some histological degenerative changes of the pulp. However, this is the first paper of its kind to report the incidence of revitalization, and it has basically two parts: retrospective part where they will collected all the biopsies at a certain period of time, and also the prospective part where they will follow up the patients. So they ended up having 48 cases included in this study. Half of them could not be reached, and also some of them were excluded. So we ended up having 22 patients available for follow-up in this study. And what they found was that 12 cases out of 22 cases shows pulp necrosis at the follow-up period. 10 of these 12 cases were diagnosed histologically with odontogenic cyst. There was no statistically significant difference observed regarding the factors included in this study, except for the follow-up period. So teeth that were followed up more than 1 year have higher probability of developing pulp necrosis compared to teeth that were followed up for less than 1 year. Obviously, this study has a small sample size, which make it difficult to draw a conclusion out of this study. However, I think it is important to have an estimate, a number that we can provide to our patient whenever we are performing such procedure.